In this video, I want to talk you through the process of drawing up a drug from a glass vial. In this case, we're talking about adrenaline for medical emergency use. So opening the glass vial, drawing up the drug and preparing it for intramuscular injection. This is not something you're going to do on a regular basis. In fact, you may never have to do it, but we do need to be able to know how to do it from a medical emergency perspective. So first things first, in terms of equipment, we have your glass vial. Apologies, this text is probably going to be mirrored for you. They come in a plastic container. So we'll just open that first of all. And then here's your glass vial of the drug. So we have adrenaline 1 in 1,000, and there is 1 milliliter in this tube, 1 milliliter. There's also an expiry date on it. Now, this is very out of date, which is why I'm using it in here, but the expiry date there, you'll see, is November 2017. So before you use this, even in an emergency situation, you do need to check that expiry date to make sure it's safe to use. The next thing we have is our syringe. Now, this is a 1 milliliter syringe, and this is what should be in your medical emergency kit. The most you're going to give a patient in one dose is 0.5 milliliters. That's for your adult dose. So if you're trying to deal with a bigger syringe, so say like a 5 ml, even 10 ml syringe, drawing up half a mil is going to be virtually impossible to do that accurately. So a 1 ml syringe is what you're looking for. And then the other thing you need is a needle for administration. Now, most medical emergency kits now come with this type of needle. So in the packet like this. So this is needle. The main needle is in here, inside the sheath. You can see it there. I'll just open it so you can see that. Be very careful. And then it has this green plastic part here. This is a large gauge needle. This is for intramuscular injection, and it can go through all patients' clothes. So you're not having to, unless they're wearing very, very heavy, say like overalls or maybe really, really thick denim, you can just go straight through people's clothes for this. So it is a big gauge, the 21 gauge syringe needle, and you can see it actually. If I open it back up again, like you can see how thick that is, and that's what we're looking for. The purpose of this part of the syringe is this is a safety mechanism. Inside, you can just about see there's a little clip. What happens is, once you've used this needle, so that you don't have to resheath it, because this is an emergency situation, you're likely to maybe not have the steadiest hand, you can just click the cover over, and then that's it. It's safe to then dispose of. I will show you that once we've done the drawing up. So that's the 3 things you need. The vial that you've checked the date on, a 1 milliliter syringe, and your needle. So what we need to do first of all is open this vial. So we need to make sure there's no liquid in this top part, because that's what's going to break off. If I shake it here, you will see there's liquid in there, and we don't want it to be. So you turn it the right way round, but it won't automatically drain out. I've got a little air bubble, but there's liquid there. So we can give it a little flick like that. And the other thing you can do, I'll just angle the camera down a little, is if you round and round on the surface like that, and very lightly tap, but not any more so, because if you tap harder, this is designed to break, so you can open it. You don't want to damage the tube. So normally just a little gentle flick should do it. And now I can see that my liquid's all in the bottle. If you look at the point where the label stops, there's a little gap in the label there, you can see. So we'll get it all out of there. Now we're looking for the blue dot on this. You see the blue dot just there. The point at which this vial will break is this narrow neck. So we put our thumb on the blue dot and our finger the other side, and we snap it like this. this is meant to break. It's thin glass here, so you do not need to squeeze hard or put a lot of pressure on this. You literally can just bend it and it will come off. If you're anxious about doing it, you can always hold it in a paper towel if you need be, but it really will just break at that narrow point. So thumb on the blue dot, and I'll just, there we go. So I've now got my open vial, and this is the lid. This is glass, so please be careful, dispose of it properly, don't just leave it lying around. Also, don't be trying to put your finger on top of either of those in case you cut yourself. So I'll put the lid to one side. Now I'm going to put my syringe together. So I'm going to close my syringe. I'm going to take the green part of the needle and push it on firmly. Then I'm going to fold back this sheath and take the plastic sheath off this. This is now a sharp needle, be careful. We will put this flat onto a surface to introduce the needle into it, because if I try and do this whilst I'm holding it, obviously there's a chance I might hurt myself. So if I just pop that down there. So I'm going to introduce the needle into here with my hands away, and then I will pick it back up. And now, holding this upright, I'm just pulling back the plunger, and I'm going to draw way more than I need initially. So I've actually drawn up 0.6 millilitres there. Now I need to get the air out. So if I bring the camera back up, I'm going to put it upright, and the air bubble is stuck down here, so I'm going to give it a wee flick to make sure that comes back up. It's been just taking a little bit of time. Sometimes you have to give it quite a fair click. Okay, so now the air bubble is up here, and I'll just push the plunger down. You will get a little bit comes out then, that's okay, until the air is clear. And I've got a drip. Okay, that's me ready to go with this now. Make sure you've got 0.5 millilitres, of course. I've just got a little bit extra. 0.5, okay, because we've drawn up excess. So we need to get the air out and also make sure we're at 0.5. So if I show you here, we are at 0.5 millilitres, ready to use. I would now take that and administer it in the upper thigh of the patient. This bottle will still have 0.5 millilitres left in it, because there is 1 millilitre in the whole thing. Keep that to one side. In case, in the very rare situation, you needed to administer a second dose, you've got it there for that particular patient. It saves you having to open another vial and slow down in that process. So 0.5 is there if you need it. Once I've administered, so in order to administer, I'm literally just going to put that straight through the patient's clothes, and I'm going to push it out relatively quickly. Once I've done that, now this is when this cap comes into use, because all I need to do is push it over, hold the needle at the hub, obviously not anywhere near the tip, and click it in. And now that would take quite a lot of effort for me to open that back up again. It's kind of like a safety plus, but in this form. And now that entire thing would be disposed of in the sharps. So I would encourage you to have a practice doing this process, because it's not something you're going to do on a regular basis. You need to be able to do it if you need to. We generally do this using out-of-date drugs, and I'll try and get that opportunity for you.